Welcome to the Silverbridge CPA's Summer Speaker Series. We hope you enjoy this message.
Recording this, so if you don't want your faces in, turn off your cameras. It looks like pretty much everyone has. So we're really fortunate to have Mitch come. He's an independent Medicare agent here with us tonight, sharing his knowledge on Medicare and what's new for this area in 2022. I'll introduce him shortly, but first there's just a few items to go over. One, if you haven't already, please mute yourself. You can do this by clicking the microphone in the upper right-hand corner. And then, like I said before, this presentation is being recorded, so if you don't want to be in it, please turn your camera off. And you are welcome to type any questions you have into the chat feature, and at the end of the presentation, I'll read back through the questions and let Mitch answer as many as possible. And then if we have time, we can also open it up to any other questions you may have, and those can just be asked by unmuting yourself. So with that said, let me introduce you to our speaker. Mitch and his family happily live in Meridian, where they enjoy many outdoor activities together, particularly biking and hiking. His agency is built on hard work and integrity, and he is excited to serve the Medicare recipient community and their wide range of needs. So with that, I'll go ahead and turn that over to Mitch.
Thank you, Bethany. Thanks for filling in for Brittany, who is probably feeling just fine and off playing somewhere. Let's see here. So to everybody who's here, hey, thank you so much for joining. I'm pulling up here my presentation, one moment. And let's see. There we go. Okay, so yeah, as mentioned, my name is Mitch Lyman. I'm an independent Medicare agent just here in Meridian, and I'm going to go through basically a quick Medicare 101 presentation. So this will kind of be a big 30,000 foot view. Try to cover all of the basic points, and then certainly questions afterwards. A little bit about me, or I guess my business. I would recommend, whether it's me or somebody else, if you're approaching Medicare, or if you have Medicare right now and you just kind of need annual service and help, work with an independent agent. One of the benefits that I offer is I'm contracted with all of the companies in Idaho, so I'm not limited in any kind of plans or services that I can offer. I guide first-time Medicare recipients. So as you're approaching 65, I guide you through the enrollment process. At the very least, with all of my clients, I try to talk annually during the big open enrollment period in the fall, just to make sure that you're still on the best plan for you. And then just provide year-round support, somebody who can answer questions, who will answer the phone, not talking to a different customer service rep all the time, somebody who's local, who knows the plans, kind of knows the healthcare system and knows the needs. So that's kind of what I have to offer. And then let's kind of jump into this real quick. Before I do have to clarify. So there's a couple of different types of presentations I can do. For one like this, I do have to keep it educational only. So that just means that I can't go into any specific plan details, which for a group this size is actually, it kind of works out better to just keep it general, because ultimately specific plan details just kind of have to do with everybody's personal situation. But just a heads up, this will be educational. So if you have questions that are, they would pertain to the group, or, just kind of general Medicare questions, like I said, let's, go ahead and put those into the chat so that we can review them at the end and make sure that we covered everybody's needs. Here's a quick agenda. Just, again, as you kind of look through there, basic Medicare points. We'll start with parts A, B, C, and D, and we'll end with, kind of enrollment periods and, what you might need to do next. So Let's start here. If you're approaching Medicare, this is probably a good depiction of how you're feeling right now, because it is, it's a government program, so they do a very good job of making it confusing. So again, that's where working with an agent helps. Certainly working with an independent agent, I feel like is, going to be your best bet. Like I said, whether it's me or anybody else. But get some guidance, make sure that you get enrolled properly during the proper time. And then as you can kind of see there in the picture, towards the top, the maze just kind of never ends. And that's kind of how it's going to be just year after year. Plans change every single year. It's good to at least just once a year check in and make sure that you're still on the right path, and have somebody that can help you with that. Jumping in, so let's start with parts A and B, because that's what's referred to as original Medicare. And part A is hospital insurance. Basically inpatient hospital, skilled nursing, that sort of thing, basically covers, any kind of procedures, anything that happens when you're in the hospital. I will note, because this will come in later, that there's typically no cost for part A. Basically, if you or a spouse have worked for 10 years in this country, then there won't be a premium for part A. So the vast majority of people who enroll at 65 are enrolling in at least part A. Part B is a little bit different because it does have a premium. So part B is medical insurance, and it's so it's going to cover just doctor's offices, specialists, x-rays, labs, personal equipment, just kind of anything on that side of the spectrum. And the part B does have a premium. It changes every year. So this year, 2022, it's $170 a month and has a $233 a year deductible, which is, obviously a low deductible. But because it has that premium, people do have the option to defer part B if you do already have credible coverage. So basically meaning that, if you have a employment plan, or you're covered on a spouse's employment plan, you can defer part B. It would be good to take that plan and compare it to Medicare options, compare costs, compare copays, compare whatnot. But in some cases, I'd say probably 60-40, it usually makes sense to go with the Medicare plan. Sometimes it does make sense to stay with employment plans. So take a look at that. But that's part B. Part B is medical coverage. Some of the things that original Medicare doesn't cover are going to be right here. There are others, but these are the major ones. So prescriptions, we're going to talk about that next. Prescriptions fall under part D, which is drug coverage. Home custodial care, care with outside of the U.S. So Medicare is definitely a inside the U.S. thing, unless you have an Advantage plan, which offers foreign coverage. So we can talk about that later. But the other big things are going to be hearing aids, vision, glasses, contacts, that kind of thing, and then dental. So we'll talk about how that gets covered here in a little bit. With right here. So actually, I'm going to pop back real quick. Down there at the bottom, it says cost sharing, so covers 80% of costs. So that's for both part A and part B. So all of what is considered original Medicare, hospital and medical insurance, any services that you get, they will cover 80% of the cost, and you are then responsible for that last 20%. So the question then becomes, how do you get help with covering that 20%? So for quite a while, for decades, it used to be that supplement plans were the only way to go as far as covering that 20%. And there'd be varying degrees to which it covers. Just a few years ago, so 2018 is actually when more people started signing up with Advantage plans than supplement plans. And we're actually at the point where it's now probably 85% plus are doing Advantage plans, but we'll talk about the difference here. So starting with supplement plans, everybody's going to have original Medicare Parts A and B. So that's your $170 a month. Okay. With the supplement plan, it doesn't include drug coverage. So you would have to add on a Part D drug plan. Those are usually pretty inexpensive. The vast majority of the time, I have people on a plan, which is that $7 to $15 a month. If you have some really tricky medications, we might have to get something else. But like I said, vast majority of the time, it's really easy. Right now, so if you're aging in and you did get a supplement plan, the plan you'll probably get is a Plan G. It's excellent. It basically just covers the whole 20%. It makes things very easy. It makes things simple. And particularly in cases of very bad health situations, like let's say, active cancer diagnosis or something like that, this is going to be a very solid way to keep you covered. So that, you can see at the bottom, there's going to be an approximate total of $360 a month, and then you're kind of out the door. So then in the 90s, Advantage plans came along. Here in 2022, especially here in Idaho, we have gotten to the point where the plans are incredibly good. I'm also licensed in California and Oregon and Utah, and things can be hit or miss. But here in Idaho, especially Ada and Canyon County, we have phenomenal plans. So still original Medicare Parts A and B, you're still paying that $170 a month. Okay, but now rather than paying a high premium and getting that coverage through a supplement plan, the vast majority of Advantage plans we have here in Idaho are a $0 a month premium, and then you're paying copays on top of that. So it's actually going to look very similar to coverage you've probably already had your whole life, right? Pay a little bit to go to the doctor, pay a little bit to go to a specialist. If you get admitted to the hospital, there's a daily copay up to a certain amount. With Advantage plans, because there's those copays, you would have a max out of pocket. So there is a safety net. You're not just going to be paying copays forever and ever if something catastrophic does happen. And then what has people leaning towards Advantage plans really at this point is all of the extras that they offer. So the dental coverage, the vision, hearing, gym memberships, over-the-counter benefits, which is basically an allowance to purchase, over-the-counter drugs, over-the-counter vitamins, Band-Aids, that sort of thing, kind of everything that's in that section of Walmart, if you can, just kind of picture that. So with Advantage plans out the door, you're in that 170 to 194 range. So people do tend to like the lower price tag of the Advantage plan, just keeping in mind that there is the risk of, having a bad year and hitting that max out of pocket. So then the question becomes, do you think you would pay less in copays on an Advantage plan than you would in monthly premiums with a supplement plan? And the vast majority of the time, you'll be paying less with copays. And certainly with individual situations, I could kind of help break that down a little bit better, especially if we were looking at what those copays were. But with some of the company trainings that we receive every year, it's pretty consistent that it's 90+% of people pay somewhere in the $600 to $800 a year on average copays. So far less expensive than the monthly cost of a supplement. Now, doesn't mean that supplements are a bad fit in some situations. Certainly, like I said earlier, if you're enrolling in Medicare and you have an active, cancer diagnosis, I would say start on a supplement plan because chemotherapy could definitely get you to your max out of pocket. I do have clients who just want a simple situation. They don't mind paying the extra for a supplement plan just so they don't have to think about copays or if a bill is going to come, they just want it to be simple. They pay their monthly rate and they're out the door. So meeting, analyzing your situation certainly helps with deciding which one of these paths you want to take. And then if you do land on the Advantage side, here we have 46 different plans from 10 different companies. So that's kind of where I can come in, ask you some questions, find your preferences, find your needs, and help guide you toward the plan that's going to be the best fit for you. Again, some differences right here. As I scanned through here, we covered pretty much everything except for networks, actually. So I kind of glazed over networks. If you have original Medicare and a supplement plan, you can go see any provider that takes Medicare. So that's a lot of them. Some don't. So essentially your network becomes whoever takes Medicare. With Advantage plans, you would have networks depending on the company. That could be statewide, it could be nationwide. So there are networks and involved as far as who you can see. And then another thing I glazed over, that very last point on supplement plans. So supplement plans do have underwriting, except for when you're turning 65 for the very first time. So you could just enroll in anything you want at that point. But then in subsequent years, if you do want to enroll in a supplement plan, you do have to answer a handful of health questions. Let's see. Okay, so this one right here. So Part B is drug coverage. And this slide right here is illustrating what's called the donut hole or the coverage gap. In this presentation scenario, I don't go too far into detail with this just because it doesn't affect the vast majority of people, but I just wanted to have the concept, especially because you might be hearing the terms donut hole, coverage gap, maybe not know what it's talking about. But essentially, if you have a lot of different medications that are brand name or specialty medications, you might get to a point where you reach this coverage gap where you kind of max out your plan, what your plan will cover. And then you pay a little bit more, and then you reach another max where you actually end up paying a little bit less. And then it kind of all starts over year after year. Like I said, this doesn't come into play for the vast majority of people. If you're just taking a bunch of generics or even just a couple of brand names, this will probably never be your situation. But again, just drawing attention to the terms, especially coverage gap. I've had a lot of people ask, does that pertain to Part A or Part B? Does that pertain to my medical coverage? What do they mean when they say coverage gap? So this is only referring to prescription drugs. If we have a conversation and you do have a lot of brand name drugs, then we can talk about kind of specific details of how that works. 2022 came with some really cool changes, especially here in Idaho, and then changes to both supplement and Advantage plans. So if you're already on a supplement plan, or if you're leaning that, the first two bullet points right here. So this was just brand new as of a couple months ago in March. Supplement plans here in Idaho used to be, the price used to be based off of age. So paying more the older you are. The state of Idaho changed that to where it's it's a community rating, meaning everybody pays the same amount regardless of age. So it can still vary based off of company or plan, but not based off of age. And from what we've seen so far with the prices, that's been really beneficial to the recipients so far. Along with that change, there's a new supplement enrollment period just around your birthday, where you do have the ability to change plans without health questions. So that is actually a huge change for folks who do want to be on supplement plans. And then moving down from there, the biggest change to Advantage plans here in Idaho have been dental coverage. So dental and Medicare has kind of always been like oil and water and just not meshing very well. but a lot of plans here have added dental or increased their dental coverage here for Advantage plans in Idaho. So that's really great. And then the last 3 points there are just kind of illustrating, at the very least, if you're already on Medicare or if you're approaching Medicare, like I said, every year, no matter who you're working with, you should at least just review your coverage, make sure that your plan is still the best fit for you, make sure it's not an outdated plan, see what has changed with other plans and how that compares. It's just, every plan changes every year. So it's definitely worth the little bit amount of time there in the fall to review that. We'll close here with enrollment periods. I'm guessing this one is probably the most relevant for this crowd, but your initial enrollment period. So this is when you turn 65 and it's your birth month, and then 3 months before and 3 months after is when you can first start enrolling in Medicare. If you are collecting Social Security already, that enrollment will be automatic. But if you're not, you will have to be proactive by going to the Social Security website or calling one of the offices and proactively applying. So like I said earlier, so Part A is premium free. So pretty much everybody enrolls in at least Part A at this time. If you do have work coverage that is less expensive than Medicare Part B, or better coverage, or both, or you just like it better, whatever's going on, you do always have the option of delaying Part B and picking that up later, which we'll talk about right here. So there's a handful of special enrollment periods during the year. If you move out of a service area, like if you move to a different state, if you get a low income status, there's actually a couple of dozen, but those are some of the bigger ones. But a very common one is going to be this top one, where you're dropping your work coverage. So if you did delay Part B, you can decide at any time to drop your work coverage, and that creates a window where you can add Part B. And I want to clarify here because it's a common question, common problem. Sometimes people think that they have to wait until the fall open enrollment period to drop their work coverage and add Medicare. And that's not the case. So whether it's right now in the spring or summer or after open enrollment period, whatever, it doesn't matter. Basically, whenever you decide to drop work coverage, you have the right to enroll in Part B. So just so everybody's clear on that. And then from there, once you have it, you can join an Advantage plan. You can kind of get everything situated. Oh, and then, yeah, in the fall, I've referenced this a couple times. You're probably well aware, but October 15th to December 7th is the big free-for-all, crazy open enrollment period. There's tons of commercials on TV, tons of mailers in the mailbox. But basically here you can change plans, you can change types of plans. With supplement plans, there could be underwriting, but now is the time. I mean, not right now, but during this period is the time to analyze your current situation, make sure that your plan's still the best fit for you. Contact your agent. If you only talk once a year, this is the period to talk. So let's see here. So a bunch of questions that you might want to ask yourself when deciding, what type of plan to take or enroll in. I'm not going to go through all of these individually, but you can kind of just take a look here. This kind of illustrates just how individual Medicare can be. Even between, husband and wife, you can have two completely different types of coverages. So things to consider about your health, what coverages you already have, where you live, what your network preference is, all kinds of different things. And like I said, with 46 different Advantage plans, it can get confusing. And so that's where somebody like me comes in to be able to guide you through these questions and help you kind of make sure you're on the right path. Your major general resources are going to be right here. Probably the biggest one, Social Security, because that's where you do enroll for the first time. Medicare.gov is pretty handy. You can create an account and you can kind of keep track of, of any bills that you get or anything like that. And then obviously the local health and welfare. And then from there, like I said, whether it's me or somebody else, I would highly recommend just having a local independent agent, just so it's another person. It's not necessarily a company rep, but it's somebody that can help you year round with general questions and guidance. And maybe you have a situation that needs to be escalated. That's some of the things that we can help with. So please jot down my information if you feel like you have questions. I will note that my services are always no cost. If you don't know, kind of us as insurance agents, we get paid by the company, so our commissions are already built into plans. So it's basically a service that's already available, so it might as well be taken care of. So feel free to reach out at any point and even just get some free questions answered. So that's the end of the official presentation. I'm going to clear this out so that I could see the chat, but then also Bethany, if you want to start taking a look if there was questions.
Yeah, thank you for your presentation. It looks like we just had one chat throughout, and it was from Paul Terry, and he asked if the cost per month was per person.
Oh, yes. Yeah, sorry about that. Super common question. And the answer is yes. Yeah, so Medicare is a very individual thing. So that $170 a month for Part B is per person. Yeah, so especially if you're trying to gauge, a husband and wife, costs on an employment plan versus Medicare, multiply that 170 by 2. And then Paul, I see the international travel options question. So that's going to come into play with Advantage plans. They are, there's usually some amount of international coverage built into those plans. So like, I know that there's Blue Cross plans that have like a $25,000 international limit per year, right? So if there's a problem, you're good to go. If you don't have that coverage in whatever plan that you do end up picking, there are options for just kind of smaller, international travel plans that you could take a look at as well, which I don't do, but I know that people use that as a common situation. Let's see, Mike. So mother-in-law is paying Part D penalty. It's on private insurance before. How could this be avoided? Yeah, so Part D penalty comes from not having drug coverage for over 63 days in a row. So kind of a tricky situation, or I guess question to answer, because I don't know her exact situation. Generally speaking, if you do have credible coverage and you have prescription coverage, then it's just like Part B where it can be delayed. So just all they want to know is that you have prescription coverage. So for her, there had to be some sort of period of time where she didn't have prescription coverage, and then as a result, paying a Part D penalty. Sorry, that's vague, but that's kind of the best I can do with that one. And then certainly if you want to unmute yourself and ask a question too, go for it. Yeah, or if not, that's perfectly fine too. So again, I know it's a very general presentation, which I kind of have to do by law, but it is good to, if you've seen that before, to review it. If you've never seen it before, to have it. And then again, for your specific set of circumstances, whether it's prescription drugs or the type of coverage that you want or any kind of guidance you have, please feel free to contact me. If you didn't get my contact information on that page, reach out to Silverbridge, ask them. But yeah, it's what I do all day, every day, is just kind of help answer people's questions and help get them on the right path. And even if Medicare is not currently the right path for you. So yeah, Bethany?
It does look like we have 2 more questions in the chat.
Oh, there we go. Let's see here. Oh yeah, Mike. Yeah, so there's not a way to overcome that penalty. That is a lifetime penalty, unfortunately. I don't know how big hers is. Typically, I've seen that Part D penalties are relatively low, especially compared to Part B penalties. Those can start to add up. The main feature is just making sure that there's credible coverage. Paul, how does Idaho compare to better states? Okay, yeah, so kind of backing up to what Medicare Advantage plans are. In general, the US government doesn't want to be an insurance provider, so they're willing to outsource that work to private companies, right? So like United or Humana or Blue Cross or whoever. So they basically say, hey, Blue Cross, if you will cover Paul, we will take a chunk of the Medicare fund and pay it to you, okay? And then Blue Cross takes that money, they formulate their plans of what they have to offer people. And the more customers they get, the more people that they take from the US government to take care of, actually the more money per person they get. And then they're able to use that to offer better and better plans. So here in Idaho, it's, as far as why it's different here, maybe than I would say California is kind of the most egregious, is even though there's 10 companies and that might seem like a lot, it's actually it's a real good solid amount. So like, for example, in Los Angeles County, there's, I think at last I checked, there was like 125 different plan options with way too many companies, right? And so it gets diluted. They can't necessarily improve their plans as fast as we have been able to here. That's kind of in general why it's different, because plan options are just based off of county to county. Some counties in California are actually way better than the plans that we have here. So there is kind of a hit or miss, but I feel like we're at a good, like a very good point as far as consistent plans and good coverage. Pam, the $170 a month premium, yes, you're right. That is income based. So that is the starting point for Part B, and it does go up from there based off of income. So this year, I believe it's $185 per couple. If you make over that, then it could be increased. So yes, that is the starting point. And Paul, yeah, Paul, you're welcome. Mike, you're welcome. Thank you. Perfect. So.
Awesome. Thank you. Just as a reminder for all of our guests, we do have more summer speaker series coming up in the next couple months here. So you can look at those on our website and sign up right there, or you can email Brittany at silverbridgecpas.com. And if you have any other questions, yeah, just reach out to Mitch. You have his contact info. This was awesome. Thank you so much for coming and speaking to us, Mitch. Really appreciate it.
Thank you so much for having me. And thank you to all the guests. Thanks for taking time out of your evening to hear this. And hopefully it was helpful.
All right. Thank you.
All right. Thanks, everybody.
Thank you for watching this summer speaker series. If you would like to tune in to future presentations or connect with this speaker or Silverbridge CPAs, please visit us online at silverbridgecpas.com.